Welcome, everyone. We are here today with our Why Do You Vote social action campaign. And today's topic is We Vote for Women's Bodily Autonomy. And I'm going to share my screen for a second and just give some info about our campaign before we get started. So we are a nonprofit, nonpartisan campaign that is part of Money Out, Voters In. And we are focusing on 7 issues that have over 70% support: marriage equality, women's bodily autonomy, our climate, background checks for gun sales, universal access to healthcare, the influence of money in politics being a major threat to our democracy, and the need for honest, fairly run elections for all. And the reason we are doing this campaign is because we want to change the conversation to our future, because most people don't vote for candidates. They vote because they feel it can affect the outcome and it's a right and a responsibility. So we want to change the conversation to the future we want and help get there, because Gen Z and millennials only vote for candidates at 13 and 10%. So we feel we should be having a different conversation, and we're bringing that conversation to social media. And today is a part of our weekly coffee chats, sorry. And I'm really excited to invite Moné Holder from Florida Rising. And later we're also going to have Lauren Beene, who's with Ohio Physicians for Reproductive Rights. And I also want people to be, if you want all the information on what's happening across the country, I'm sharing now our shared Google Doc or spreadsheet so that you can find out what is happening on different bills across the country and learn about how we can support women's bodily autonomy. It has been on the ballot in eight times, and it's won all 8 times. And I'd really, I'd love people to share why, if they want to later, why they are here, why they care about this, if this is personal. The reason we're doing this is to bring people's voices. We're going to have a Spark the Vote challenge September 14th and 15th to bring real people's voices to social media, talking about how this impacts them, because nothing moves people like personal stories. So Moné is on the ground in Florida, and she can share what's been going on in Florida and how this affects real people every day, and, the chaos that ensues when these laws get, changed like that. So thank you, Moné, for joining us.
Thank you so much for having me. It's an honor. And I realize how early it is on your side of the country. So it's noon here. But once again, my name is Moné Holder. I'm the Chief Advocacy and Political Officer at Florida Rising. And for folks who are not familiar with Florida Rising, we are a people-powered organization. We are made up of members advancing economic and racial justice across the state. We believe every individual has power, but we have more power together. Our core issue areas are expanding democracy, which includes voting rights, criminal systems reform, housing justice, climate justice, and of course, reproductive justice. We are a statewide organization, as I mentioned, and we have offices in 9 counties across the state, as well as staff in those 9 counties, and a membership base that is statewide as well. Just to dig in more on the reproductive side, we have been making some challenges to the legislature over the years, but most recently, Florida Rising has become an executive committee, of one of the founding executive committee members of Floridians Protecting Freedom. That is the statewide campaign of the vehicle of organizations and even citizens who are leading the ballot initiative, which we all know to be Amendment 4, that will be on the ballot in November. It was, publicly, it looked like a very fast-moving campaign. We were excited to see the amount of people across the state, across different demographics, political affiliations, everything, who believed in the same thing, right? That this is a personal decision between a woman and her doctor and not government, right? We got the signatures we need. We passed the threshold of over 1 million signatures to get it on the ballot. And then since then have been moving towards the campaign of educating folks, getting more and more organizations and people involved in this campaign and really pushing to mobilize them to the polls in November. But to take a step back a little bit, I'll give you a little bit of the landscape here in Florida. So as of May 1st, 2024, Floridians were placed under a 6-week abortion ban. Prior to that, we were under a 15-week abortion ban. Advocates, members of the community, you name it, were trying to stop the legislature from moving forward in that direction. It seemed every time there was a legislative session, there was an attack on bodily autonomy, amongst many, many other things. We even challenged it in the courts, but unfortunately, the Florida Supreme Court upheld the 15-week abortion ban, which subsequently triggered the 6-week abortion ban that we are in today. With that in mind, knowing that we had no relief in the courts and no relief in the legislature, our only resort was ballot initiative, take it to the ballots, take it to the people. And so, as I mentioned, that's how we got here. One other thing that's very unfortunate is that besides the 6-week ban, we also have a 24-hour mandatory waiting period. So that requires anyone seeking an abortion to visit the abortion provider twice in person, at least 24 hours apart, which is crazy. And even when Texas had a similar law in place, they made an exception for people who lived more than 100 miles from an abortion provider, but Florida doesn't make any exceptions. So this is critical, not only because it's an attack on democracy overall, but Florida has played a significant role in the abortion access landscape in the United States. We've consistently been ranked as one of the top 3 providers of abortion care annually. Last year, Florida saw a historically high number of patients. It was over 84,000 patients seen here in Florida. That same year, over 1 million abortions were provided across the state, which means that Florida represented over 8% of all patient visits. That's huge. That's a lot. And when you think about the 6-week ban, when most women don't know they're even pregnant at 6 weeks, that number is going to increase significantly. So as we are not only educating people about the Amendment 4 and what's at stake and that they need to show up to the polls and they need to vote yes on Amendment 4, we're also providing resources about, abortion funds, how people can get access to the care if they're post 6 weeks and need to get out of state. We know it's a wide range of reasons why a woman may choose, and that's their choice, but we're providing information simultaneously as making sure that they turn out. So I'll pause there. I know folks may want just maybe a little bit more updates on the amendment ballot initiative itself. So I'll see if there's any questions, and then I can just talk a little bit more about, I guess, the ground game, if that's what you want to hear.
Yeah, so usually we like to have each person present for 5 minutes and then we come back. So Dr. Lauren Beene has joined us now from Ohio, and I just want to quickly say again, we are, a nonprofit, nonpartisan social action campaign doing an educational effort to raise awareness about what's happening across the country. And my heart just goes out hearing this info for what this means to real Floridians. I can't imagine 6 weeks, not even knowing, and then having to go twice. I mean, some people, if you have a job, other kids at home, everything, wow, so I really appreciate that you're here and sharing this perspective. And with that, I want to now welcome Dr. Lauren Beene, who is a physician on the ground in Ohio with Ohio Physicians for Reproductive Rights. And then after that, we will open it up to a full conversation with everyone. Thank you.
Hi, everybody. Thank you so much for having me here. Sorry, I was late. I'm a little technologically challenged. Yeah, so I am in Ohio. We had abortion on the ballot last year, and thankfully we're able to successfully secure abortion rights and rights to many aspects of reproductive health care through our constitutional amendment. That was a really awesome grassroots movement, unfortunately, spurred by the ban that went into place in Ohio that was very similar to what Florida is living under right now. In Ohio, after the Dobbs decision, our Attorney General signed into effect a trigger ban that made it illegal to have an abortion after the point at which fetal cardiac activity could be detected, which was about 6 weeks. And we also had to have a 24-hour waiting period. So it was just it was a total disaster. And that lasted for about 11 weeks. And then thankfully, some smart attorneys managed to get that ban put on hold while we spent the next year ramping up everything to have an election on the ballot initiative. And so I can't even imagine what it's like in Florida right now. It just seems like I mean, it's like a total disaster. And that just breaks my heart, but I totally believe in you guys. I know you're going to be successful. And at least everything I've heard from what's going on down there, it sounds like the polls are supportive. And so now in Ohio, we are in this kind of weird limbo period where, similar to what happened in Michigan, we have constitutional protection, but for some reason, even though it was self activating, it didn't. That doesn't mean that all of the laws that are unconstitutional just go away. So, for example, the 24-hour waiting period, persisted, and that is being argued as now being unconstitutional, brought forward by the same smart attorneys that helped before. But each one of these, for us, it's about 30 trap laws and obstructionist laws has to be argued in the courts. And what's making everybody nervous is that Ohio, like many states, is terribly gerrymandered and run by a bunch of right-wing extremists that don't represent the general people of our state. And they're trying to take over the Ohio Supreme Court. We have a elected Supreme Court, and there are 3 justices that are up for election. 2 are up for re-election, and 1 is running for the first time. And they are people that seem very reasonable, and we believe would be fair in any decisions made about these laws if they make their way up to the Supreme Court. But unfortunately, in Ohio, even though the Supreme Court is supposed to be not politicized, there's the Republican Party managed to get a D and an R put next to the names of the candidates on the ballot. So you have to identify as Democrat or Republican, I guess, or independent when you're running for Supreme Court. And so in Ohio, although we like to think of it as a purple state, it is a little bit more red than purple. And so everybody's worried that the more extremist, known anti-choice candidates that are running for Supreme Court may be elected. And so that we're really worried about that happening because they could just undo everything that we've done. But thankfully, things that we have to be hopeful about are that gerrymandering is on the ballot in Ohio this year, which really has, opened things up and made a world of a difference in states such as in Michigan. And I think was it Wisconsin that had a gerrymandering? I know Michigan had a gerrymandering ballot initiative that really shifted everything and led to a much more balanced government. And so hopefully Ohio will be successful in getting rid of our gerrymandering problem. And other things that I'm hopeful about, I'm really hoping that Kamala Harris and Tim Walz win, and then that will somehow make everything better. But the situation overall in Ohio is unfortunately still stressful. But thankfully, our patients are able to get the care that they need at the moment, even if they still have to jump through ridiculous hoops. So that's pretty much the state of things in Ohio at the moment. So less stressful, but still frustrating.
Okay. Thank you, Dr. Laura Beene. And before we open it up to questions and talking more with Monet and Lauren, I just wanted to share, we have this Google Doc, which I've shared in the chat for resources. And you can see all the different ballot initiatives there if you go to this link, because then you can stay up on what's happening in your state. And then I wanted to just take one more minute to share about what we have going on to bring this conversation online in September, just before National Voter Registration Day. We are going to have the Spark the Vote social media challenge, and we have over $20,000 in cash prizes for the best short videos. $5,000 is for one about the Supreme Court in relation to any of those 7 issues we mentioned. And I wanted to just give a 1-minute example of
I
what
vote for women's choice
can
because
look
we need
like.
autonomy over our own bodies.
Start over.
I vote for women's choice because we need autonomy over our own bodies. Why do you vote?
I vote because democracy is an important part of the American spirit. Why do you vote?
I vote because the people who came before me made so many sacrifices to make my vote count. And that's why I vote. Why do you vote?
I vote because I want kids to be safe at school. Why do you vote?
I vote because of marriage equality. Why do you vote?
For our environment, to hear our planet, to hear your rights, to hear for everything. So that's the reason I vote. Why do you vote?
I vote because I believe in universal health care for all. Why do you vote?
I vote because I care about marriage equality and people exercising their rights. Why do you vote?
I vote because action is the antidote to despair. Why do you vote?
Vote.
So I hope you guys will join us. The goal is to get really personal stories. And as we talk next, I'd love to hear how this is affecting everybody you're working with, Monet in Florida, Dr. Beene, everybody you've been working with in Ohio, because if we can share intimate personal stories of what this meant and means to everyday people across the country, we can make sure we are changing the conversation to assure our rights in the future. So I hope, tell everybody to join us, and we'd love to have, more intimate personal stories to nothing moves people like, films, like hearts, it opens your hearts and minds. So I hope you'll join us for that. And if people here on the call want to share why you're here, how this has affected you, we welcome that type of sharing as well. So before we go back to them, I see Sarah, you'd like to share or have a question?
Yeah, if it's helpful. I've actually never told my own story publicly at all. I guess, as you say, many people do. It's just funny because when it developed, I thought this would have to be a good story, because how is it that people who are nominally pro-family would not understand that there are circumstances where, having abortion actually supports and enables a family rather than tears it down. But now that they're all after IVF, I realize it's like it's a fig leaf always anyway. So who the heck could care? I'll just I have 2, happy, healthy 20-something-year-olds now, but I had an abortion prior to their lives because I had childhood cancer with a very extreme chemotherapy that just made me nauseous all day, every day. And when I got pregnant and I became nauseous again, I was like, I can't do this. I just can't do this. I can't. And and I couldn't. And so halting that pregnancy enabled me to spend some time to prepare and get ready in my mind and to handle it. And it was really bad for me. The first pregnancy wasn't so bad, but the second one, I was nauseous all 9 months. But I needed that time, and it enabled me to have a family. Again, I realized that's a nonsense thing. They don't actually care about that anyway. So I thought that might be a useful story you could share with somebody, although probably not, But anyway.
Well, thank you for sharing, Sarah. I mean, this is the thing. It really affects people, and it should be a personal decision. and that the government's trying to get in our bodily autonomy for our health care and our economic freedom is, most people don't agree. I think that it's over 70% say that's not okay. And as Dr. Beene pointed out, we are, seeing extremists who do not represent the people, trying to take control of our lives. So this is, I thank you for sharing. This is exactly what moves people.
And can I just crystallize the point there is that without that, I actually wouldn't have been able to have a family at all. So that actually weirdly and ironically and backwardly is the exclusive reason that you could actually manage what they pretend they want. It's kind of hard and it's hard to explain and it's weird, but it is definitely my truth. You would not probably believe that if you didn't want to, but it is absolutely true.
Thank you. Does anybody else want to share? If not, Monet, do you want to share more what you're seeing with people in Florida?
Absolutely. I think, so first of all, Sarah, again, thank you so much for sharing your story. It takes courage to share personal stories like that, especially in front of people that you don't know. And I will say that story collection has been a key part of the campaign, right? As you mentioned, Holly, changing hearts and minds is critical. And it's a tool, an organizing tool that has been used for many, many decades, and it works because sometimes people don't step outside of their own box to realize how it impacts their neighbor or the person they sit next to in church. And also just to see the bigger picture outside of like women's health, quality of life for a child or a family, just mental health, all the things that we can, cross sector with the issue of, abortion. It's also part of a trickle down the effect of stripping us of our democracy. So if nothing else, if you just, when we talk to people, we tell stories, but also that if we allow this to happen, what will they continue to take away from us? What protections do we lose? What decisions do we now essentially giving up to politicians, to government that impact our daily lives? So when you ask me what we're hearing, people are scared. They're scared about what this now means for them moving forward. What does this mean in the next legislative session? Like what's going to be taken away from us? People are scared about what could happen to their bodies. We see a lot of women, especially women of color, Black women who suffer, death during childbirth, or, they have other issues with their body. And I know Dr. Beene can speak more about it, that an abortion can actually save their lives. So when they think about that, when they're trying to think about family planning or whatever it is, they're very serious about this issue more than I could have ever imagined. One other thing, key part of the campaign and what we're hearing is like, how do we get the men involved, right? So what angle are we talking to our young men and our older men about? Because we need them to turn out a vote too. We need a 60% threshold here in Florida, right? It's doable. We did it with medical marijuana. We did it with Amendment 4 back in 2018, where we restored the right to vote to 1.4 million returning citizens. So we can definitely do it again, but we need everybody. We don't just need the women. I mean, we can win anything with women. We know that. But we need you to rally behind us. We need you to support us, right? Because it's not just an us thing, it's all of us. So we are hearing and seeing a lot of people being energized. We are getting a lot of personal stories, some in which people are like, use this if it's going to help. And some people don't want it to be shared, but they felt a release in just telling the story to somebody that they know cares about the issue and cares about their body. So that's all catapulting us into what we know will be a victory in November. But it's really been an interesting and really inspiring experience thus far to be able to talk about this alongside all of the other issues that we're facing here in the state. And especially in a critical year like this, where we have big elections up and down the ticket, some people who are feeling apathetic about voting overall because they, may not have identified with a candidate prior to some recent news, or they may, have a quarrel with their local or state elected who's on the ballot, so they thought they weren't going to show up. I'm like, this is bigger than that. If you care about this, you have to go. So, it's interesting in the field. We still got some ways to go, but we feel good about it here in Florida.
And how do people who live in Florida get involved?
Good question. So there's a couple ways. We have the FloridiansProtectingFreedom.com website, and there's access to resources, whether you just want to know more about the campaign, you want to get the exact language, but there's also a tab that I think says like get involved. Let me go to it myself.
And we can put all the links in that shared spreadsheet.
And that website will let you know different ways you can get involved, whether there's local actions or canvassing in your area. If you're not a canvasser and you just want a phone bank or text. And then most importantly, if you want to donate, because in addition to being out in the field, we're actively raising money towards this campaign. Ballot measures cost an extreme amount of money by design, right? It's led to deter citizens from getting their issues on the ballot. And we estimate this campaign to be about $98.5 million. We're not anywhere near there yet, but we're getting there, especially during a presidential election year. Every sort of communication that you want to do is extremely expensive, but we can't leave any stone unturned as it relates to this campaign. So again, FloridiansProtectingFreedom.com has information about the initiative, but also how you can take part in events across the state. There's also the individual organizations that are a part of what we call FPF or the campaign. So you can go to floridarising.org in our events tab, and you'll see various opportunities because, of course, we work on other issues besides reproductive justice, but we have specific amendment for campaign opportunities throughout the state every week, every other week leading up to it. So those are the two ways that you can definitely find out how to get involved.
Great. Thank you, Moné. And I'd love to hear from Dr. Beene about people you've seen directly affected. And then it's crazy that you are talking about the Supreme Court then trying to come and undo what you guys worked so hard to pass. It's like we just can't rest. Like we just I mean, I'm laughing because I want to cry. Like
I know. I live in like a little like bubble of denial, but that's the only way I can cope. But yeah, the Supreme Court thing is really scary, and I don't know what's going to end up happening with that. But yeah, I mean, people that have been directly affected by that. Well, so when Ohio did have the ban, which was for 11 weeks in 2022, there were just an incredible number of awful stories. And I think that like while I feel very strongly that, people don't need to give you a reason for why they're having an abortion, and any reason for an abortion is a good reason. There definitely are some stories that help the people who don't really understand why we must have access to abortion, understand. In particular in Ohio. So the Dobbs decision came down on a Friday, and a friend of mine who works as an abortion provider in an abortion clinic in the Dayton area, that morning she had seen a woman who was in her about mid-30s come in to do the first day of counseling for your abortion, part one, having to come back a day later. So she was there for part one, and she just looked really depressed and distraught. And so the staff asked her, before she left the building, like, hey, are you okay? Are you, is there anything we can do to help you? And she said that she was just diagnosed with stage 3 melanoma and found out that same day that she's also pregnant, and she has 2 children at home, and she's not sure if she's going to live, but she wants to be able to start chemotherapy so she can at least have as much time as she can with her children. And so that was the morning before the Dobbs decision. The Dobbs decision then came down, and the clinic had to call her back and say, I'm sorry, but we can't provide your abortion tomorrow. And like, what kind of a world do we live in that puts a person in that situation? I mean, that is just plain cruelty. And anybody who hears that story, like, it doesn't, you can't think that that's okay. If you think that that's okay, then you are not okay. Something is wrong with you. And so the people who worked at the clinic were able to get her out of the state, and she ended up getting an abortion a few days later. But like, just talk about feeling like you have no, like you're so thoroughly unimportant and unappreciated, and that your life means nothing to the people in charge of our state. So like those kinds of things are heart-wrenching. And then there are plenty of other stories that are not nearly as dramatic, but you know, it's just, it's all awful. Anytime, it's already hard to get healthcare when you need it in our country. And when you put up these absolutely asinine barriers, people get hurt and people die, people bleed out, people get infections, they end up in the ICU. Um, there's a there was a really beautiful piece that I think was published in the New York Times, where they they had a really good photographer come to the Cleveland Clinic and take pictures of what it was like to be a doctor there in the post-Roe world. And one of the doctors who was interviewed was involved in our organization, and she told a story of a woman who was about 16, 17 weeks pregnant, not anywhere close to like the viability period. And she developed an infection in her uterus and became septic. And she was so sick that she was in the ICU, but the doctors couldn't perform an abortion because the fetus still had a heartbeat. And so they were like, talking to the attorneys to make sure that they're not going to, all go to prison. And I think that, which, a lot of people say, well, why didn't the doctor just perform the abortion? Well, it's not just one person who has to make the decision about a person having an abortion, especially in an ICU setting. You've got multiple doctors and nurses and respiratory therapists, and you have all sorts of people who all can be implicated in, what is considered a crime. And so it's almost impossible to move forward. And that woman, another heartbreaking thing, before they ultimately got legal approval from Cleveland Clinic's legal department to do the abortion, they had to ask her if she wanted to hear the heartbeat. And like, can you imagine being mandated to ask a woman who is septic in the ICU if she wants to hear the heartbeat of her dying feet? I mean, like, what the fuck? Sorry, my language, but like, that's insane. So just, it's so awful. So anyway, so I could go on forever, but they're all these stories are awful, and they should not be happening in anywhere on earth. Especially, the Cleveland Clinic. This is like world-class medical care, and that's how the people are being treated. So anyway.
Yeah. On that note of like the ultrasounds, I got married late. I was almost 40, and I was actually trying to get pregnant, and they wouldn't perform an ultrasound on me just to check me out because they're like, oh, that's a waste of money. Yet they force that on when like I was like,
right?
I'm trying to, and I can't get this.
Yeah.
I had to wait and come back, yet they mandate that in certain states.
Yeah.
Is ludicrous. Okay.
Yeah. They're using it as a punishment. Yeah, it's terrible.
Yeah, I was like, really? And I had a fibroid, which I had to operate, but I couldn't find out that day. I had to wait. And at 40, that means a lot as you're trying. And Sarah has her hand up.
Thanks. I was just wondering, Dr. Beene, if you ever envisioned becoming a, legal and social radical when you went to school to do this. I mean, you're not that old, so you would have been post those days.
Yeah, no, not at all. Like, and I'm a general pediatrician. I'm actually at work right now. So this was like by no means in the cards for me. I'm not an OBGYN. And then before the Dobbs decision, I really wasn't involved in any of this. I just knew that it seems like a good idea to be able to make choices about your own healthcare, but I didn't even really understand what it meant beyond that. But actually what happened was on the Monday after the Dobbs decision, I came to work. That's when I really found out that wow, abortion's actually illegal already in Ohio. What happened? Because I have then a 5 and a 2-year-old daughter at home, and then my weekend was chaos. So I came to work and oh my God. And one of my patients' moms called first thing in the morning and asked if we should put her not sexually active 13-year-old daughter on birth control to protect her in case she were raped. And I was like, I don't know how to respond to that question. That's never been asked that question before. But that really hit me like a Mack truck. And I realized, wow, this is a pediatric crisis too. This is not just a women's issue. This is an everybody's issue. And then I had another patient who the previous week I had been trying to help. She's a 16-year-old African-American girl who I know her and her family very well. They're wonderful people. And she was pregnant and was trying to decide if she was going to continue the pregnancy or not. And she was about 8 weeks pregnant, and she had been seen already at our local abortion clinic, but she had an appointment that week to see OBGYN because she wanted to have a conversation with an OBGYN before she made her decision, which I thought was a really good idea. And I had to call her that morning and say, hey, if you want to have an abortion, you can't wait to see OBGYN. You have to go back to the abortion clinic today, and it might already be too late. And I was sitting there in my office talking to her. We have 2 offices in my practice. One office is in Shaker Heights, which is a very diverse community. We care for people that come from all sorts of socioeconomic backgrounds. And then another office in Solon, where I was that day, which is a super upper middle class suburban community where everybody's privileged. And I was just thinking about wow, I have so many patients who, if they were in this situation, would have entirely different experiences. My patient that I was talking to on the phone that day, if her family had to get her out of the state, that would be an enormous stress for her and her community. Whereas I have plenty of other patients who it would be no big deal at all. And that also did not feel right. But anyway, so that day really changed my life. So now I have turned into apparently a radical, even though I think I'm very reasonable.
Totally reasonable. Very reasonable.
Totally reasonable.
Sarah, I see you have your hand up again.
Yeah, I don't want to monopolize things. I just, when you were speaking, and also thinking about how I sort of framed my abortion story as being ironically, pro-family, that inversely to that, as you point out, these questions about should I enable my 13-year-old to have an IUD or whatever it was in order to protect them against a rape. As a parent, my late teens, I discovered one of them had an IUD that was put in at the college health service. And I know IUDs have changed a little in their sort of safety profile, but and also, it's not my business if my kid's sexually active, but I was just kind of surprised. And I did ask her, and she was like, well, no, I just figured, as you say, for safety. I'm like, what?
Yeah, it's a weird world that we live in right now.
I don't think this is not how I would. Anyway, I don't strongly feel that, and especially a late teen, that I have a mandate. It's not they're their own people. They can make their own choices. I just, the weirdness and suspicion that inserts in a relationship with your kid, and the abdication of my right to actually have those conversations with my kid, that they are thrown into a world of fear and terror and suspicion, and they also then think of your elderly parent as kind of not a safe place to go for this conversation. It's so anti-family. It is so ridiculous. It's just so ironic. And the notion that these guys use this big lie as in every possible way that it's, family oriented. It's just ridiculous. I just can't even.
Thank you, Sarah. Yeah, it's interesting. I also heard that in Texas, maternal health care and the outcomes of, in birth has since these bans have gone into place has worsened. And you made a mention in the comments about this being a healthcare issue versus and universal healthcare. As you saw in our 7 issues, we like that we have the intersectionality of healthcare rights, voting rights. I know Monet's group also works on voting rights. Like it's all like we keep having these conversations in a siloed way, but what we see is that they actually are all connected. And we're all complex beings. So it's like we all, most Americans want over, I think it was 86% want people to have equal access to healthcare. And we see this, especially in communities of color, that they're not getting adequate maternal health. We see, I mean, Monet, maybe you could speak to this, what's going on, but it's a tragedy. Like all women deserve equal access to good healthcare, and that's not happening. And it's affecting certain families more than others, even than when they are born. And like I was listening on another call about healthcare about, like, can you have a doula who, if you're African American, you'd like an African American doula. How nice, like to feel fully supported in your childcare, or whatever choices, healthcare choices, whatever your choices, that we could have, equal access, full representation, and adequate, for our, of the freedom for our healthcare, the freedom for our economic future, all of that.
Yeah, I mean, totally. Medicaid expansion has been one thing that has been huge in state that we've been fighting for since I can remember joining this work about a decade or so ago. It was also something that people were thinking about making a ballot measure, and are still discussing it because of the healthcare crisis overall. It's been interesting to watch, like both how, state and local government are dismissive of it, but how communities have come together to take care of each other. You mentioned the usage of doulas, and I know like one of my colleagues here runs, our Black constituency program, but she's also a doula. That's her night shift, right? And has successfully built a network of Black doulas across not only just Jacksonville and the state to connect mamas with. And if you don't have health insurance, but you want the care of a doula, let's figure out how we can still get you the care that you need, or consult with you on some things, or even deliver that baby for you, because that is what is important. One other kind of program I like here in Jacksonville, and I'm not sure if it's in other parts of the state of the country, is Volunteers in Medicine. So it's I think almost all women-led physicians who volunteer their time. They have an office in like downtown Jacksonville where a lot of, we have a huge homeless population and a lot of, people who just don't have healthcare. So how do they get that service that they need from good quality, reputable doctors? So even if we haven't gotten our government to do it for us, we're trying to figure out how to get it done ourselves. But that also is a constant fight that we've been having here in the state alongside reproductive health attacks as well.
Thank you. Does anybody else have any questions or something they want to share? And again, I'm going to share the spreadsheet one more time, and then our website one more time, because I know people might want to get involved in the challenge, we hope. There we go.
It's certainly interesting how this stuff is, speaking of ironies, it does seem to be very, and Florida's experience, and as you say, everywhere that, abortion has been on the ballot, it has been actually, counterproductive to these other people's agenda. And helpful to ours. I mean, it is just so, stimulating and engaging. And I'm sitting here, head exploding. I don't need to be engaged, but obviously it's getting others off the couch.
Well, we can all speak up. We can all write letters, postcards, text. There's some great, I think we're gonna have a call about texting, getting people out to vote. We had a great call with the voter guides a couple weeks ago. So, we've got a lot of great educational information, and we're also trying to reach educators, and we're recording these so that we can share them. And I think the conversation we've had here is important for people to hear about. And, it really is interesting thinking about the young, the daughters we have who are immediately facing this, who are young. Like, thank you for bringing this up, because I hadn't, and I have a 10-year-old now. It's like, oh boy. Where,
And you know what?
yeah.
And the cynicism and we that we see among our youth, this also contributes to it. I mean, that daughter who I keep my voice down, who did take it on herself to have this IUD and stuff, she has such a chip on her shoulder, so much negativity to the world that sort of forced her to this. I don't blame her for it, except this is no way to move forward. I mean, you have to have, some sense of more autonomy and hope that has been being slathered onto it. I mean, it's such, I don't know, you start sticking your tinfoil hat on it. Is such a effective control mechanism. It winds up making a beaten down, cynical, non-engaged population, like in fact we have. If you want to do this test and ask yourself, is our youth this way? Well, it's really enraging.
It's really affecting them. I mean, they've grown up in a pretty crazy world. What's happening with repro rights, the pandemic, climate change. It's
Gun violence,
a lot for them. And our next call on this issue, we are going to go over what is across the country on the ballot. We're going to hear from Chris at Ballot Initiative Strategy Center. They have an ongoing list of where this is, on which states it's made it to. I'm sharing it here in the chat. But we hope you'll join us in 7 weeks for our next call on We Vote for Women's Bodily Autonomy. And I so appreciate everybody having this conversation. I think it's so important. We can support our sisters. I'll say our brothers too, because the men need to join us. And this is across the country. It has been winning. We have to keep assuring that it's winning everywhere that it is, because it affects all of us. I mean, we all, like I have tons of family in Florida. I have, it's like we're all connected in this country, and we have to have each other's backs. So please, share this call, share the recording. All the recordings are on our website, on our events page. So please, it will be here later today. I will, and we will try to, share this with educators, share this with people you care about. Do you have your hand up again, Sarah, or is that just?
No, I didn't. But although I do have a question, are we allowed to, so we'll have access to this spreadsheet later? Because there's tons of really interesting links in here.
Yes, I'm not sharing it, publicly, because people have their information, but whoever's on the call, are here as a conversation. The goals of these chats are to connect, empower, and engage, and give you the resources. So it will, you can come back to that. It'll be there. And again, the call will be on our events page. And I really thank you all. Does anybody else want to share anything before I stop the recording and end our hour?
Thank you.
So thank you, Moné. We wish you luck. We are all here. We will keep spreading the word. Thank you, Dr. Lauren Beene. Your perspective has been so helpful. I'm so grateful that we were able to have this conversation today and to pass it along to others. So I will